The last area, I think, is the importance of collaboration. You know, what we see over and over again is the system is only as strong as its weakest link. You know, you can be a terrific police officer, well-trained. You can be a terrific Crown attorney. You can be an excellent judge, you know, who has really good skills in intervening in domestic violence cases. But clearly, the whole community has to be involved. There has to be good support services for victims, good risk assessment. There has to be good risk reduction strategies, treatment for men who are abusive. We have to find ways to put all the pieces together so there's genuine collaboration in the community.
I think the message would be that we have to collaborate better, that we have to work together better. Those of us who work in different sectors, it's like a kaleidoscope. The family are the beads, but you can turn that kaleidoscope and see a different pattern. I think sometimes what we've done is we haven't done enough perspective taking and worked together enough so that we get positional. You know, I don't consider myself to be someone who's not a woman's advocate, but I do consider that my part in this whole problem is to help make sure children are safe.
The beauty of this kind of work is that you're doing the work anyway. I mean, you're managing these cases in your office anyway. So wouldn't it be desirable to have extra help from various agencies to help you strategize and manage these cases? So for us, there's no more cost. We just make the time to meet once a month to discuss the cases, and then as need be, we may email daily or be on the telephone daily or whatever. But the idea is that these cases need immediate attention. So they're not routine cases. They have to be red flagged. They have to be assigned. You know, when decision making is made on these cases, they have to have approval from, you know, the higher levels, so that you don't have a case where someone just decides arbitrarily, for example, at a bail hearing, well, we'll just release this person. You know, so that decision has to be made by someone who knows the dynamics of these high-risk cases.
The Alberta Relationship Threat Assessment and Management Initiative, known as RTAMI, is a multidisciplined joint forces threat assessment unit to deal with high-risk domestic violence and stalking cases. So it's the first of its kind in Canada because it is not just police-based. We have 5 different police agencies with 8 police members who are trained threat analysts and experienced police officers with years of experience in major crimes investigation. And they take all sorts of, when they come to us, they take all sorts of training in threat assessment and risk management. And we have a in-house Crown attorney, a family lawyer, a children's services representative, and a victim safety consultant. And in addition to that, we have a consulting psychologist and psychiatrist who we can consult.
The Criminal Organization High Risk Offender Unit is a subunit in Winnipeg Adult Probation Services. It was created because there was a demand for services to the highest of the high risk offenders that weren't being serviced properly. This unit has taken a lot of what is now evidence-based treatment principles of matching the intensity of service of service to the intensity of their risk level. So we've been able to have our caseloads capped at 15. We're able to have much higher frequency of reporting and contact by phone and in person and in the community via the PO and also an attached community corrections worker. And so the dual pair will devise the assessment, the intervention plan, and work super closely together to implement strategies, and we meet and revise that plan weekly.
This is a protocol that's called the Nova Scotia High Risk Case Coordination Protocol that was brought about in 2003 in Nova Scotia to coordinate high-risk cases where we think that there is lethality that's going to happen, and most often the lethality will be of the woman being killed by her abusive male partner. And so some of the practices in high-risk case coordination protocol is the hiring of domestic violence case coordinators who are with police departments in the province of Nova Scotia who manage the case files. professionals. We do information sharing among primary service providers who are part of this protocol, and they are men's intervention programs, women's shelters, police, victim service agencies, corrections, child welfare, and the Crown. We do safety planning with the woman. We install domestic violence emergency response systems, which are DVERS alarms. We do case conferences when the woman's case is incredibly complex and we feel that there's great concern about her, and we provide emotional support and referral and a point for the women to contact us and get information from us on how the case proceeds through the criminal justice system.
The Huron Assessment Risk Reduction Team is a group of justice partners who meet monthly to discuss high-risk domestic violence cases. The membership of this team is restricted to those people who work the cases, so membership includes the Crown Attorney, probation and parole, the police, victim witness. We also have a resident psychologist with probation that sits on that team. And basically what we do are manage high-risk cases that we've identified in our community. Well, I think a minimum requirement for a high-risk team would be the justice partners that work the case. I think ideally it would be great to have more community input from various agencies like the Women's Shelter, mental health, that kind of thing. Unfortunately, we have to deal with these confidentiality restraints, but there are innovative ways of getting around that, and some communities actually have made these various agencies kind of special constables so that it gives them permission to discuss cases with them. My vision for the future would be that every community would have their own high-risk team. If not community partners at the table, at least have them consulted regularly, have systemic responses available in terms of solutions for some of these cases in place, and develop a non-adversarial approach.
Neighbors, Friends, and Families campaign is a campaign to teach everyone about the warning signs of woman abuse, about the risk factors when the risk is elevating, also to teach basic responsive skills. So not to be a counselor, but how to respond empathetically if someone discloses that they're experiencing woman abuse. It has an element on talking to men who are abusive. And finally, it's teaching about the local resources that are available that you can refer a woman to or a man who's using abusive behavior. This campaign was developed because we have the Domestic Violence Death Review Committee that's been reviewing every single death related to a domestic situation since 2002. And when we look back, what we're learning is that many times there were clear risk factors associated with these deaths. And what we know is that people who held most information weren't professionals. They weren't the violence against women advocates, the shelter workers, the counselors. They were people very close to those who are experiencing the abuse or who are exhibiting the abusive behavior. So that is neighbors, friends, families, and coworkers.
I think kind of like the last frontier, so to speak, are just neighbors. I think that we need to sensitize neighbors to the early warning signs or the signs of domestic violence. In my research of domestic homicides, I found that neighbors were the wild cards, that there were some women that were saved by their neighbors. Some women, victims of attempted homicide, I should say, were saved by their neighbors who just happened to buy. But then there were many victims of attempted homicide who said that their neighbors knew about the violence but didn't do anything. And there's some research that suggests that one of the reasons that bystanders do nothing is that they don't know what to do, or they assume that someone else is taking care of it. So I think we need to put that information in the hands of just regular citizens, regular neighbors, to help them to identify what are the signs of domestic violence. They may think of what's happening next door as just an alcoholic husband, for instance. And then secondly, what are things you can do that are safe for you? Because I think another reasons why bystanders sometimes don't respond, they're concerned about their own safety, too. And so how can you safely intervene? Calling the police, for instance, would be one example of that.
What we do know is that if we do nothing, the situation will escalate. We have way too many examples of that at this point. But that means that we have to actually be able to communicate to neighbors, friends, and families and co-workers that there are simple things that you can do, and that doing something, even if the woman doesn't respond positively in the moment to you, it can actually be the beginning of her reconsidering her situation, of her knowing that there's support available, and it does increase safety.
There's a program called Ganaway, and that's really looking at how do we protect each other? How are we? Can we in our communities be responsive and know what the key signs are around abuse being evident? And so that instead of closing your ears to what's going on in your eyes, of really being open to that and providing in our communities where actually women will help women and other community members will, rather than doing what often happens in the city is you turn your head away.